What I like to start out with is to find out, just everybody say their name, and if there's one thing that you would really like me to address in this presentation. So.
Okay, I'm Pastor Carol Green, and what I'm interested in hearing about is things that can be done to help prevent obesity.
I'm Julianne, and I'd like to hear about how to help muscle aches and pains.
Okay.
Yes, hello. My name is Heather Daniel. Anything in nutrition concerning, muscular aches and pains for osteoarthritis, all the inflammation.
Okay.
Thanks.
Yes.
Bernetta Hayes, psoriatic arthritis.
Okay.
Ashok Sharma, and I'm quite active, and I think I eat healthy and everything, but I like always open to learn new things and see how I can optimize the workout as well as the diet and everything, Okay.
Wonderful.
Tom Shepard, and I'm just interested in getting advice in a general way that might be helpful. I don't have any specific area.
Okay. Well, let me just give you a little bit about my background, and so you kind of know where I'm coming from. And I think, as you'll see in this presentation, that my approach is one of an integration, meaning taking the best of all worlds, not just a drug approach or not just a manipulation approach, but I like to bring all the things together and base it on science. That's the important thing, is to base what I'm going to be telling you on science, and there's proof of it. Now, it may sound like I'm bashing a little bit traditional medicine, or we call allopathic medicine, but I'm not, because there's many times when that's very applicable and very useful. Traditional medicine tends to be much more effective for emergencies, for acute problems. Like if you break your leg, you certainly want someone to mend your leg. But when it comes to chronic problems, and we'll go over what that means, things like cancer and diabetes and heart disease and dementia and so forth, traditional medicine is not that effective in that. They're more masking symptoms than anything. And so what I'll be telling you today is more of how to get the information to give your body the ability to heal itself and prevent illness. I mean, that's where really it's quite important, is to prevent illness, and that keeps costs down and it makes you much healthier. Unfortunately, we don't realize something's starting to happen in our body until it really is kind of end stage. And that's where the problem is. So one of the things that you'll see, and we'll talk about, is a device that I use called the Zyto. And a couple of you know about it. Pastor Carol has been the recipient of that, as is Julianne. But basically, you can put your hand on here and hook it up to my computer, my program, and you can find everything that's going on in your body, what's the priority, and then exactly how to take care of it. So it picks things up quite early. And can you just give a very short testimony to what you experienced when I did this for you?
It was very remarkable. I couldn't believe it. Dr. Bob asked me a few general questions, about my health. And then he placed my hand on the Zygo machine. And he was able to tell me that I had he was able to let me know, because I didn't tell him this prior to, that I had a missing tooth all the way up at the top that I was waiting to heal so I can get replaced. I had a urinary tract infection, and I was told after I was tested at the gynecologist that I didn't, that the test came back negative. So I went home, but yet I was still feeling a little uncomfortable. The machine was able to detect that I had it, as opposed to it being able to be picked up by a normal test that I had gotten in the doctor's office. So it's he was able to detect that I had a high stress level, which I do. I'm always under a great amount of stress because I work for the government during the day and also pastor the church. So that's a lot, and that can bring on a lot of stress. And so he was able to detect things like that. And everything he said, it checked out. I was actually under a tremendous amount of stress. And the machine picked all of those things up. Whereas if you go to a normal doctor's office, oftentimes the test that they administer, it does not pick up a lot of these things. And that's why you get so to the point that when something is wrong with you, where they tell you that now you have cancer and all of those kinds of things, it could probably be picked up earlier had we undergone a test like with the Zygo scan, as opposed to just going to the doctor's office for a normal appointment. And so I was astonished. I was like, I couldn't believe it.
And that's one of the points I'll bring out, is that many of the traditional tests that are now administered by doctors and so forth pick things up more late stage. And most chronic illnesses don't manifest until about 7 to 10 years. Whereas this can pick things up at week 1, month 1, year 1, and in fact it's almost in real time. I can tell people, well, what you ate an hour ago is giving you problems right now. So that's the value in many of the tests that I do and work with on people. So let's get started with our show here. And the idea is that you can achieve optimal wellness if you have the information. So, unfortunately, we start off with the bad news, okay? The bad news is that as it pertains to your health, life expectancy is now decreasing. Okay, that's a big concern. Now, there are many things that go into that, but for centuries, life expectancy increased. About the past 3 years, according to the CDC, the Center for Disease Control, is now our life expectancy is slowly decreasing. So our kids are going to live shorter than we live, okay? So that's a big concern. It's a little red flag there. The environmental toxins are dramatically increasing. I mean, everything in the water and everything that we're eating, our houses, in our cars, what we put on our skin and so forth, contain a lot of toxicity. And as that builds up, and I'll show you, that's one of the big causes of a lot of chronic health issues. And so the ability to get rid of these toxins, because you'll never be, you'll never live in an environment where there's no toxicity. Whether you're chanting on the top of a mountain or wherever you are, you're going to be exposed to some toxicity. In fact, what's interesting, my good friend Julianne here conducts a lot of journeys to Nepal, and in fact, there's huge amount of pollution and toxicity on Mount Everest. So you can't escape it where you are. And so toxicity is increasing. On the other hand, our nutrient levels are decreasing in our foods. Okay, the crops, the fields where the crops are grown decrease in amount of minerals and nutrients in it. And unfortunately, unless you're very careful in what you eat and where you shop and so forth, is the amount of nutrients is decreasing. So you have to be very aware of that, and this is where supplementation comes in, because you could think you're eating all the right things, and you may need to take some supplements if you're not getting them in your food or you're not absorbing them. So that's a concern. The healthcare in the United States is the most expensive in the entire world, okay? By far and away than the next 3 or 4 countries combined. And so a lot of people forego their medical care, health care, because they can't afford it. And one of the things that we're going to show you is that you can dramatically reduce your health care if you have good information, okay? And you prevent illness from happening. Prevention is far less costly than going and getting a surgery or going on drugs for the rest of your life. And that has to do with, one, your knowledge, but also picking things up early, okay? And I don't know if you know this, is the average adult in the U.S. is on 5 prescription medications. That's the influence of the drug companies. If you ever watch television and you see some of the commercials for you know, this, that, or the other drug, the last half of the commercial is all, you know, all the things, well, if you have this, you know, go see your doctor. If you have this and this and this, if you have this. And that's a red flag. If you notice in those commercials, they say it very softly at the very end. You know, if you have this and this and this and this, and be careful. So one is better off being able to avoid drugs where you can, or find nice, natural, healthy alternatives. I'll give you one example. One of the biggest areas that prescription medication is given is for blood pressure, okay? And in fact, what's interesting was what was considered normal blood pressure a year or so ago, the drug companies, to be able to sell more drugs, said, well, maybe we better even lower it more so more people take drugs, okay? You got to remember that the drug companies, their bottom line is their bottom line. And so the more that people get in their mind that I have this little ache or pain or whatever, let's take a drug, as opposed to an alternative, that's what we're going to show you. As I say, the biggest impediment to optimal health is lack of information or misinformation, okay? And so we talked about that, the 5 prescription medications. So we're going to show you a lot of things that people can do to avoid that. Okay. Okay. But there is good news, very good news. And the good news is that the number of people living to over 100 is increasing. Now, if you want to read an interesting book, there's a book called The Blue Zones. The Blue Zones, they find out in the world where there are a very high number of people living to 100 and more, okay? And they say, what's the consistent factors in those people living to 100 or more? They have clean lives, they're physically active, they're socially engaged, and they just avoid a lot of processed foods and so forth. But more and more people are learning how to be healthy until 100 or more, okay? And these are the people we want to emulate. Now, little sidebar here. Everyone has a story about their great aunt that lived to 103 and she smoked every day and she drank bourbon and so forth. Everybody has, and they say, well, why can't I do that? Well, these people are genetically very lucky to have genes that are good detoxifiers and so forth. Believe me, most of the population does not have that. And if you live that kind of a life, you're not going to be very healthy, and you're going to live a miserable life. And I can't tell you how many people that I have in my life or hear about that they have a heart attack at 55 or 60, and you know, and that's sad because that does not have to happen. In fact, I have a later slide that says the future of healthcare is that the information's out there to be able to live to 120 plus years, healthy years, okay? And more people are aware of the importance of health, okay? Many, many more people are aware of this. If, you know, 20 years ago, maybe only the grocery stores that had sawdust on the floor and so forth are the ones that had organic food. Now, every store has organic food, whether it's Giant or Harris Teeter or whatever. Every store has organic aisles because they know that's what people are demanding now. Organic meaning it's not raised and grown with all the pesticides and the chemicals and so forth. Okay, now I wrote a blog. Well, I wrote a blog called "The Wizard of Oz: Healthcare and Politics." Basically, I think all of you have seen the movie The Wizard of Oz. At the very end of the movie, the good witch comes down and says to Dorothy, "You always had it under your control," meaning she could go back to Kansas anytime, just click your heels together and say there's no place like home. Well, that's the way it is with healthcare. And all these battles about who's covering healthcare and, you know, what deductibles and all this kind of stuff, to be honest, health is in your control, okay? You really do have health. If you have the right information, what to eat, when to exercise, how to detoxify, those kind of things, you can live a very, very healthy life with minimal medical, pharmaceutical intervention. Okay, it does happen, and it's nice to know when that should happen, but really you have it in your control, and that's what the intention of this is, to give you the information to take control. Now, you have to incorporate some of those things, so that's very important. So that's what we're going to talk about today, is how to take control of your health. The information to great health is available, but you need to understand it. Misinformation is the biggest impediment to optimal health. Okay, so you really do need to understand this to be able to get healthy. Okay. So, as a take-home, what I want to tell you is that I'm going to give you a huge amount of information, okay? And you're going to go, oh my God, how can I do all that? I can't, you know, I'm going to be taking this many supplements. No. What today is, if you can figure out, take 3 or 4 ideas or strategies, put them into your lives, and eliminate 2 to 3 of the challenges that you now have, and I'll identify many of those for you. If you can do those things, those action steps, then you will dramatically improve your health, okay? I'm going to give you one right now, okay? So this is what everybody should be doing. One of the most important, and they even call it an organ system, the most important things is your gut microbiome, okay? And things like antibiotics and pesticides and so forth that in our foods are going to destroy that good bacteria. But it's really important that you get and keep replenishing that good bacteria. They even call it an organ system, okay? And it helps with immunity, it helps with the nervous system, it helps with elimination, it helps with so many things. In fact, I just read an article about 3 or 4 weeks ago, is that one of the most important things to help with depression, more than Prozac and all those other things, is a good, healthy microbiome, okay? Because the gut and the brain are connected. So here's your take-home. Everybody should be on something that's going to replenish the microbiome. That could be fermented vegetables. What I take personally is I take a spoonful of sauerkraut in the morning and a spoonful in the evening. That's loaded with probiotics. Julianne drinks, what is that you're drinking right there? Kombucha, which has probiotics. And I know that Julianne continually replenishes her microbiome. So that's important. And if by some chance you end up having to take an antibiotic, okay, they're very much overused, but they're very important at times. If you take an antibiotic, you really need to up your intake of probiotics, good bacteria, okay? And one of the things, I know Carol has told me this, is that I told her to take a spoonful of sauerkraut, hold it in your mouth, and what happens is the good bacteria migrate up into the sinus. And many of my patients, my clients, have sinus problems, and that's from infections that get up there. The good microbiome that migrates up there is going to compete with and knock out the bad bacteria. Okay, so I think that's given you some good results. Yeah. So that's one of the important take-homes that I'll cluster. I will give you certain take-homes as we go through this. Okay. Now, one of the most important things is to realize that people can take the suggestions, take good things, incorporate in their life, but everybody's a little different, okay? Everybody has a different genetic makeup, Everybody has a different upbringing. I can't tell you how much people's upbringing has to do with their health now, okay? And so everybody's a little different, and one of the trends in the coming years is going to be to customize healthcare. I can tell you everybody should drink water and everybody should do this, everybody should, but we all need to figure out what exactly is going to make us optimally healthy. And I continually, continually read about it, but I am always changing little things that I'm doing to see what works and what doesn't work. So I'm kind of an experiment on myself at all times. Yes?
On the probiotic thing, I read someplace that wherever you travel, I travel a lot, so you go to, wherever you go, first thing you want to do is have a yogurt over there or something like kefir and all that,
Yes.
because that basically lines your stomach. So is that a good probiotic, I mean, for the gut's health?
Yes,
Yogurt
yes.
and the kefir?
Yes. It's very important to keep replenishing that microbiome, especially when you're traveling. In fact, has everyone ever heard of Montezuma's Revenge? You go down to Mexico and I went scuba diving many, many years ago and I came up with that. Well, that's the bad bacteria which you're not used to. And if you travel, whether you're traveling to a healthy country or not, when you travel, you should be taking a huge amount of probiotics because the food elsewhere is going to be a little bit different than the food that you're used to here. Okay, so very important. And in fact, with all the things in the news now about immigration and so forth, when they move from one country to another, all of a sudden their microbiomes are different and they change. Okay, so that's a huge importance, is to replenish that microbiome, and so you can deal with the new microbial exposures you have in different countries. Okay, and new immigrants should be getting their microbiome replenished because they come with a different microbiome. Okay, whether they're coming from a Latin country or a European country or an Oriental country or whatever, they really do need to do that because the foods are different. Okay, so that's important, is to take a couple of ideas here, put them into your life, see if they work, and eliminate some of the not so healthy things. Okay. First, I want to give you a couple of definitions so we're all on the same page. Acute versus chronic. Acute problems are problems that happen to us, like you catch the flu, or you break your leg, or you have a concussion. Those are acute issues, okay? And what treats that, I mean, there's many things that we do. I'll give you one example, but the traditional allopathic healthcare is very good at, generally pretty good at treating acute problems. But when it comes to chronic problems, meaning things that take a long time to develop, the diabetes, the arthritis, the cancer, those things have been happening a long time. A woman who goes and gets a mammogram and has a breast lump, that's been going on 8 years, 8, 9, 10 years, okay? Wouldn't it be nice to be able to have picked that up at week 1, month 1, year 1? And here's another thing for women is probably it would be better to get a thermogram rather than a mammogram, okay? Now, what is a thermogram? Thermo means heat, and inflammation, which is the basis for arthritis, and anything that ends in itis is inflammation. And that usually is, inflammation means pain, usually, okay? Now, a thermogram picks up inflammatory changes, which are the earliest things that happen, okay? So like if it's prostate issues or breast issues or gastrointestinal issues or that kind of thing, you're going to get an increase in blood flow to that area to take care of the problem. An increase in blood flow increases the temperature in those areas, okay? So a thermogram measures slight changes in temperature And so it could pick up breast issues or other inflammatory issues far earlier than they become a disease problem, okay? And so we won't get into the politics of mammogram versus thermogram and so forth, but realize that a thermogram picks things up far earlier and it allows you to take action much sooner.
But when you gynecologists have a thermogram?
Probably not. Probably not, because they've been schooled and educated in doing mammograms. And what I didn't even know what the policy now. Every 2 years or 3 years, a woman should get.
Yeah, it's annually up to a certain age.
Okay, and I again, I don't want to get into the politics of that. There's a few places that do have thermograms. I have a clinic where we do thermography, but there's a big concern. And don't take this as don't do one, but there's a big concern that the radiation from mammography may cause problems to happen.
Well, if it doesn't, the squeeze itself does.
Well, exactly. So very important. Here's another tip. This is for women too. Okay. Another tip is that they say that women who wear a bra for more than 12 hours dramatically increase the rates of breast cancer and that kind of stuff. What it's basically doing is where the elastic or the metal in them is cutting off the lymphatic flow to keep breasts healthy and so forth. The other thing why, and we'll get into this, other thing why prostates and or breast are very susceptible to disease is because they're fat tissue. And fat tissue picks up a lot of toxins and is stored a lot of toxins, okay? And that's why they get more frequently diseased. So along with that issue is people who want to lose weight, okay? When you lose weight, you're dissolving fat cells. And as I said, fat cells store a lot of toxins, so you release a lot of toxicity into your system when you lose weight. And so you need to be, or should be, detoxifying while you are on a weight loss program. I told this story last night to illustrate this. I think every one of you probably knows who the Grateful Dead is, okay? Now, the Grateful Dead, the guy that everybody knew from the Grateful Dead, Jerry Garcia, he smoked a lot of recreational drugs and so forth, and he was quite overweight. Well, he met a woman, and he fell in love, and he said, I'm going to go on a crash diet. Well, when he did that, went on his crash diet, he lost a lot of weight and released so many of those drug toxins into his system that it killed him, okay? So you've got to realize that if you are going to lose weight, and we have a very, very effective weight loss program, if you want to lose weight, then you've got to simultaneously be detoxifying, okay? And we'll talk about that.